Do you know what rheumatoid arthritis is? Well, it's not just your regular joint pain. Rheumatoid arthritis, often abbreviated as RA, is a chronic inflammatory disorder that primarily affects the joints. But it doesn't stop there. It can also impact other parts of your body, including your skin, eyes, lungs, heart, and blood vessels. This disorder is autoimmune, meaning that your body's immune system mistakenly attacks your own body tissues. Most commonly, it affects the joints in your hands and feet, causing painful swelling that can eventually lead to bone erosion and joint deformity. The inflammation associated with rheumatoid arthritis is systemic, meaning it can affect the entire body, leading to physical disabilities and frequent fatigue. It's a condition that calls for understanding, awareness, and effective management. Now that you know what rheumatoid arthritis is, let's delve deeper into its causes. So, what causes rheumatoid arthritis? An intriguing question, isn't it? Rheumatoid arthritis, or RA, is an autoimmune condition. This means that the body's immune system, which usually protects us from harmful invaders, gets a little confused. Instead of focusing on external threats, it starts attacking the body's own tissues. It's like having a bodyguard who suddenly decides to turn against you. The main targets of this internal assault are the synovial joints. These are the joints that allow for smooth movement between our bones. When the immune system attacks these joints, it causes inflammation and damage, leading to the pain and stiffness often associated with RA. Now you might be wondering, why does the immune system get so confused? Well, the exact cause is still a mystery. It's thought that a combination of genetic factors and environmental triggers like smoking or infections might spark this autoimmune response. Understanding the causes helps us recognize the symptoms. Let's explore them next. How do you know if you have rheumatoid arthritis? What are the signs and symptoms? Well, rheumatoid arthritis, often known as RA, can manifest in myriad ways. One of the most common signs is tender, warm, swollen joints. These are often noticed first in the small joints of the hands and feet, causing discomfort and difficulty in movement. Another hallmark symptom is morning stiffness. If you're waking up to stiff joints that take an hour or more to loosen up, it might be a sign of RA. This stiffness can be more than just a morning nuisance. It can interfere with your daily activities and quality of life. Generalized fatigue, low-grade fever, and unexplained weight loss are other symptoms that might accompany RA. These symptoms are often subtle and can be easily overlooked or attributed to other causes. But remember, if you're experiencing any of these signs, don't ignore them. If you experience these symptoms, it's important to get checked. Let's discuss the investigations involved. How is rheumatoid arthritis diagnosed? Now, that's a question that requires a little bit of diving into. Rheumatoid arthritis isn't diagnosed with a simple yes or no test. It's more of a detective's game, piecing together various clues to arrive at a diagnosis. First stop on this detective trail is the blood test. Doctors look for certain markers like the rheumatoid factor and anti-cyclic citrullinated peptide antibodies. These are often present in rheumatoid arthritis, but not always. And sometimes they show up in other conditions too. Next, we have imaging tests like X-rays, MRI, or ultrasound. These tests can reveal inflammation and damage to the joints that's typical of rheumatoid arthritis. Then comes the physical examination. Doctors might check your joints for swelling, redness, or warmth, and assess your reflexes and muscle strength. It's like assembling a jigsaw puzzle, and once the picture becomes clear, we have our diagnosis. Once diagnosed, treatment is crucial. Let's talk about the treatments available. What are the pharmacological treatments for rheumatoid arthritis? That's a question that often comes up when discussing this condition. Well, there are several types of medications that can help manage the symptoms and slow the progression of rheumatoid arthritis. Let's start with non-steroidal anti-inflammatory drugs, often referred to as NSAIDs. These are commonly used to reduce pain and inflammation. They're a broad class of medications, and you might recognize some of them, like ibuprofen and naproxen. Next, we have steroids like prednisone. These medications also reduce inflammation and can help manage acute flare-ups of rheumatoid arthritis. They can be used in the short term to control symptoms while waiting for other medications to take effect. Then we have disease-modifying anti-rheumatic drugs, or DMARDs. These are a critical part of the treatment plan. Unlike NSAIDs and steroids, which primarily manage symptoms, DMARDs can actually slow the progression of the disease. Some of these include methotrexate and hydroxychloroquine. There are also newer medications known as biologic response modifiers. These target specific parts of the immune system to suppress inflammation. Examples include etanercept and adalimumab. Each of these medications has potential side effects and risks, so it's important for patients and doctors to work together to find the most effective and safest treatment plan. Remember, pharmacological treatments are not the only solution. Let's look at some non-pharmacological treatments. Apart from medications, what other treatments exist for rheumatoid arthritis? Well, let's delve into the non-pharmacological methods that can be employed alongside medication to manage this condition. Physical therapy is one such method. It involves the use of exercises to keep joints flexible. Therapists may use techniques like heat or cold therapies or even devices to help reduce pain and inflammation. It's important to remember, though, that physical therapy should be performed under the guidance of a professional to avoid any potential harm. Exercise is another crucial element in the non-pharmacological treatment of rheumatoid arthritis. Regular physical activity helps maintain joint flexibility and muscle strength, which in turn can help reduce pain and fatigue. Activities such as walking, cycling, swimming, or even yoga can be beneficial. But remember, always consult with your doctor or physical therapist before starting any new exercise regimen. Lastly, lifestyle changes can make a significant difference. A balanced diet rich in fruits, vegetables, lean proteins, and healthy fats can help manage inflammation. Limiting processed foods and sugars is also a good strategy. Additionally, maintaining a healthy weight and quitting smoking can improve overall health and reduce the risk of complications. To conclude, non-pharmacological treatments for rheumatoid arthritis, such as physical therapy, regular exercise, and lifestyle modifications, can play a vital role in managing the disease. Remember, early detection and treatment can help manage rheumatoid arthritis effectively. If you found this video helpful, please subscribe and share with others who might benefit from this information.